Welcome back. Are you afraid to smile? Do you have a difficult time eating certain foods? Are you experiencing tooth pain with loose-fitting dentures? You're not alone. Today we have a team of specialists practicing right here in West Michigan that have a solution for you. Joining me are Dr. Mark Jesin, Dr. Rosie Noordhoek, along with Dr. Richard Panek. Good morning. Thank you so much for being here with us.
Good morning, Leanne. Thank you.
And Dr. Mark Jesin, why don't you go ahead and introduce the rest of your team? I know we have a picture we want to show, not to leave anybody out.
Well, we're very excited to be here to discuss the all-in-4 surgical treatment. Nobody wants to live with dentures today. They can fall out of your mouth at the most inopportune time. They limit the foods that you can chew on, and the most embarrassing thing is that you have to figure out where to put them when you go to bed at night. So we are very fortunate to have advanced technology today where we don't need to provide patients with a removable denture.
Sure.
This technique, known as the all-in-4, is where we can place 4 implants into the jawbone, just like you see here, and we can fabricate a set of non-removable teeth that the patient can actually function on and chew on that very same day.
Wow.
Yeah. And the way we're able to accomplish such a highly complex treatment is by having a team of dental specialists all working in one center. We're the oral surgeons, as the 3 of us, and we work together with a team of prosthodontists, who is the specialist in reconstructing the smile. And we also work with a dental lab technician who's an artist in designing a customized set of teeth to match with the patient's facial profile.
An artist. I love that. It really, because this is really our canvas. Our faces are canvas, right? So you have an artist involved. There's a look at the team right there on the screen. So I want to move down the line here, Dr. Panek. I've actually heard of the single implant, but this is an entire set, correct?
Yes, that's correct. Our practice has been placing implants for almost 30 years. And approximately 10 years ago, we started using the all-on-4 technique for selected patients. Previously, it was necessary to place 5 to 7 implants in the jaw to be able to attach teeth. That oftentimes required bone grafting, which really expanded the length of time of treatment. Some people would have to wait 6 months to a year before they could get their final teeth. Science has shown that 4 implants are adequate, and with refinements in the technique over the past 5 years, our team has been able to deliver 4 implants for a patient and a set of teeth that are attached directly to the implants the same day. It's very gratifying. We really get a kick out of doing that for patients. It really makes our day.
I've been through dental trauma, facial trauma, so I understand exactly how important this is. Your self-confidence level definitely drops, but you guys are able to get people out the door quickly, so that's amazing. So let's talk, we have some before and after pictures we want to show. Here's a look at some of those people that you guys have been able to help. Can you tell us a little bit about what happened here or what they had done?
Well, most patients are dealing with multiple different problems, either ill-fitting dentures or bad teeth, and they're in a situation where they have kind of reached the end of the line as far as their options.
Yeah.
What we do is evaluate the patients. They come in for a consultation where they meet the oral surgeon, and the oral surgeon will evaluate the patient to make sure they're candidates for this procedure. The same time we do the initial consultation, they meet the prosthodontist and the dental lab technologist who evaluate their needs and desires, because every patient has unique problems. And they basically perform smile design. And between the time of the initial consultation and the implant placement, the laboratory technologist creates the teeth for the patient. That's the artist we were talking about. So that when they come in for implant placement, we can place 4 implants. Our team prosthodontist can attach the teeth the same day, and the patients leave the office with teeth the same day the implants are placed.
You probably see a lot of smiles and a lot of tears, don't you? That's
Definitely
awesome.
the reveals.
That's great. Who's a great candidate for this?
You know, we found that most people are candidates for dental implants as a whole. So, you know, if you're interested in this, we offer you to come on in for a complimentary consultation and see if this is the right fit for you. Like we've mentioned before, we found that a lot of people just are at the end of line with their dentition. They've been sad for years, they've had loose teeth, they have cavities, they don't know where to go. So if you don't have a dental home, we can obviously put you in, and because we have the whole team, we can go start to finish with your treatment plan, which is really nice.
It is nice.
Now, some of our patients have been seeing their general dentist for years for regular checkups, and you know, they've just come to that point where the teeth aren't savable anymore. This is a great opportunity for us to work with our colleagues in the community and to come on in, and we'd love to work with those dentists to just transform these patients' lives.
That's right. And we talked about the smiles and the tears. Let's talk about the overall impact that you've had on these patients' lives.
Well, everybody comes in with a different story. Some have lost their teeth due to cavities, some to gum disease, and some to illnesses and trauma. But the common thread amongst them is that they're very unhappy with the current state of their teeth. And with this solution, we've been able to restore their hope and their confidence in their smile again. They can go out to restaurants again and eat the foods that they enjoy to eat. they can actually taste their food to the full extent because they don't have a plastic denture covering up all their taste buds in their mouth.
Yeah.
And for instance, they can swim in the lake again because they're not afraid that their denture is going to fall out and they won't be able to retrieve it. So we're literally transforming people's lives and allowing them to live it to their full potential.
That's great. You guys are doing amazing work. You really are. So once again, if you'd like more information or to set up a complimentary consultation, please give them a call at 616-361-7327. I'm going to say that again. It's 361-7327, or visit ngsmiles.com. That's nancygsmiles.com, ngsmiles.com. Thanks so much for stopping by.
Thank you.
Thank you for having us, Leanne. We appreciate it.
Absolutely.